Hi everyone, this short video is just about completion of the clinical learning tools that are within the midwifery practice portfolio. There are 26 of these clinical skills that need to be assessed, and assessment of these occurs in combination with the NMBA standards for midwife practice from 2018. There is information in the midwifery practice portfolio about the completion of these tools, so feel free to refer to that portfolio at any time that you need further information. Any kind of registered midwife who has worked with the student on more than one occasion, or a clinical facilitator or a clinical educator can complete these assessments with the students. We use the Modified Bondy Scale to assess these learning tools. There is some more information about the use of the Modified Bondy Scale in another video. So if we just have a look at the skills list, this is the 26 learning tools. You can see that they are color coordinated to meet with a particular clinical placement. However, we also are very aware that learning is opportunistic and students are rostered in different areas and students learn differently. So whilst we make recommendations for completion of learning tools within certain clinical courses, we certainly don't set them in concrete. And as long as we can see that students are completing learning tools and developing in their knowledge and skills, then the timing of that completion is relatively not so important. So this is our first learning tool, which is initial pregnancy assessment. Each 26 of them are laid out exactly the same. So we'll just go through one. So you can see up here, there are 4 columns under the student and 4 columns under the assessor. So each page gives the student the opportunity to complete this clinical assessment up to 4 times. If the student feels the need to complete this any further than that, just print the page out again and continue with that. We do encourage the students to continue to complete these until they have received an overall rating of proficient or independent according to the Bondy scale. So the student, this is your job first. Write the date up here of your self-assessment, and you need to go through each one of these boxes and assess yourself according to the Bondy scale on how you perform each one of these skills. And then you need to take this assessment to a preceptor or an educator, and then the preceptor or the educator has a look at this column. Dates it here, should be similar dates. And then when the assessor is able to witness the student performing this particular skill, they can go through and again make assessments according to the Bondy scale. Every single box needs to be completed. We can't have empty boxes. They're not valid if each step is not completed. Some areas can be completed theoretically if a student needs to talk through a particular section, or can be also completed via simulation if necessary, if there is not the access to real life practice. At the end of this, again, the date and then an overall rating for each assessment: independent, proficient, assisted, supported, dependent. The assessor can make any comments here, name and signature, and the student's signature here. If any of the above boxes, if any of these assessment areas are rated as a D for dependent, then the overall rating must be also dependent. And then we probably need to have a conversation with the assessor, with the student, and with the course examiners just about how we can support this student if they're having difficulties in being able to perform the clinical skills. Under here, the student can also make some comments about their practice, about how they feel they're doing with each skill, and about how they're growing. We do expect that this is a dynamic document because students will do this multiple times throughout their midwifery practice, and we like to see that there is some growth and knowledge development over that time. If a student is not able to complete the tool successfully, then you just need to keep practice. So continue to practice, and then a little bit later down the road, do another self-assessment and go to an assessor again. If there are any serious concerns that a preceptor or an assessor might have about a student, then it's really important to have a conversation with that student and reach out to any of the USQ midwifery team, so that we can help to support that student to be able to be the best midwife they can. Thank you.